Hi, everyone. I'm India Ornelas. I am the interim chair of the Department of Health Systems and Population Health, and also an associate professor in our department and the director of the MPH Core. And we're happy to share our project with the Center for Teaching and Learning Symposium.
Hi, my name is Olivia Bjornbrent, and I am the program manager for the MPH Common Core. And the title of our project is Launching the New MPH Core Curriculum During a Year of Remote Instruction. So India, please tell us about the new MPH Core Curriculum. What is it?
The MPH Core Curriculum is a set of 6 courses that our MPH students take in their first year in order to meet the core competencies in the program. These are brand new courses, and they are taught to an entire cohort of students getting their MPH across several different disciplines and programs. All of the courses are team taught and include TAs, and the teaching teams are often from different disciplines and use student-centered learning strategies, case studies, and inclusive teaching practices. Because of the COVID-19 pandemic, we had to launch these courses online for the first time. Olivia, tell us more about how we evaluated the program.
So since these courses were brand new last academic year, we really wanted to create a robust evaluation plan to learn how each of the courses were going throughout the academic year, as well as how they fit together within the whole program. Our evaluation design had 4 different areas to it, including the program overall, each of the courses, the instructors, and the teaching assistants. We collected feedback from students, faculty, the teaching assistants, and staff throughout the academic year using various methods such as the mid-quarter and course evaluation surveys, the student focus group, teaching assistant debrief sessions, and instructor peer observations. Additionally, we got input from various committees within the School of Public Health, such as the MPH Steering Committee and the Curriculum Committee, which occur about every month. All of these assessments were analyzed and summarized by me, the program manager, except for the student focus groups, which were conducted and analyzed by our teaching assistants. So we've done all of these evaluations. What is one key finding that you think we should share today?
Thanks, Olivia. We learned so much from our evaluation, but one finding I wanted to share with you was about the student feedback that we received on the Common Core. The students really enjoyed learning so many public health skills together during their first year, but we did get some feedback that they wanted a clear connection between the courses and how the courses built on one another. They also gave us really helpful feedback on things to change about specific courses, including where they needed more support from teaching assistants, recommendations on textbooks, recommendations around the amount of group work across the core courses, and adding in more didactic lecture content. Unfortunately, the student course evaluation response rates were lower than we had hoped for, and we did see a decrease over time, but we have tried to think about ways to improve response rates this year. Olivia, can you tell us more about how we plan to use the findings?
Yeah, so all of the results, thank you, from our findings led to a series of recommendations and were shared with the instructor teams and all of our related teaching programs. These recommendations help to guide the changes made to the courses for the following year, which we are currently in right now. One of the ways that we are trying to increase how much response we get from students within all of our surveys is by sharing the results from the previous year with the current cohort. So this year I went in and shared all of the updates and changes we made with the cohort to help motivate the students to leave feedback on the current courses because we really do value their input and hope to increase the response rates this year. We feel that other programs implementing the new curricula or teaching in new modalities can learn from our evaluation approach.
Thanks.
Thank you.